At the time, people were going to Idumota to go bring drugs and all of that, people selling these drugs on the table. And for us, we were like, no, this doesn't make sense.
According to the National Agency for Food and Drug Administration and Control, NAFDAC, 17% of medications available in Nigeria are substandard or counterfeit. This rate is much higher than the global average, which according to Reuters is 10%.
There's a big counterfeit issue. There's a big quality issue in Nigeria because of the way we store medication, the way we distribute medication.
A medical doctor and a healthcare administrator, frustrated by this problem, stepped away from the hospitals and sought to fix it. Today on Seed Diaries, we share the stories of Drugstock, founded by Dr. Chibuzo, Opara, and Adham, Yehia.
We're right here. We're right here. We believe, we believe, we believe. We believe in community. Stanford Seed. We're right here. We're right here. We believe, we believe, we believe. We believe in community.
Hello everyone, my name is Wamaka Okoye, and with me here today I have Chibuzo Opara and Adham Yehia of Drugstock. And today we're going to be talking about Drugstock, what Drugstock does, their journey so far, and what their goal is with Drugstock. It's so nice to have you both here today.
Thank you. It's great to be here, Wamaka.
It's nice to meet you.
Great. So, in a nutshell, what does Drugstock do?
So essentially, we connect manufacturers of good quality pharmaceutical products to hospitals and pharmacies. And what we're trying to do is to solve for the fragmentation in the pharmaceutical industry. And that has led to three key challenges: issues with pricing, issues with influx of counterfeit and substandard drugs, and general issues around access.
Okay.
So simply put, if you're a healthcare professional, healthcare provider, and you provide healthcare to the masses, we will ensure that the supply chain that gets to you for everything you need for your patients or for your surgery, from your scalpels to your consumables, are the best quality and at the best price from source. There's a big counterfeit issue. There's a big quality issue in Nigeria because of the way we store medication, the way we distribute medication. So from that point of view, just as long as you're a healthcare provider or a gatekeeper of healthcare in sub-Saharan Africa, we're interested in ensuring that you have what you need when you need it.
Okay. So Drugstock supplies medical supplies, pharmaceuticals and medical supplies to healthcare providers.
Yeah.
Yes, I've heard some people say, "Oh, you're essentially a pharmacy's pharmacy," or you're essentially the back end to the healthcare system. I mean, a lot of what we've done in the last 5 years is not completely visible to the end client. So when you walk into a pharmacy, you're not aware of the fact that 80% of the drugs that are purchased by that pharmacy are now going through a healthier supply chain. But you begin to notice over time that, oh, it seems like pharmacies are getting better. It seems like the quality of drugs are getting better. That's, essentially us and a bunch of people in the background ensuring that we inflict that change onto the system.
Okay, well, that sounds like a really big problem because I know we had a lot of counterfeit drugs. I mean, there was a time when it was a really big problem. It still is, but I'm saying it was so bad that a lot of people were dying because of counterfeit medication. So I'm thinking now, how are you dealing with the counterfeit aspects? What are you doing differently?
So basically what we do is we ensure that everything that comes through us comes directly from the manufacturers. So we're actually picking from the manufacturers' warehouses and going straight to the clients' pharmacy stores. So it's a bulletproof supply chain. We ensure that, so we're ISO certified for good distribution practice and for quality management services, and everything that goes through our system is trackable and traceable. So if a manufacturer today says, hey, there's an issue with my product and I'd like to recall it, hey presto, you immediately recall it within a week.
And think of that in reverse as well. When you have fragmented distribution systems, when you get a drug, you can't necessarily put blame on anybody to say, I got a fake drug. You're going to go to the pharmacy and be like, oh, I don't know, I bought it from this person. The person is going to lay it on the other person. So there's no chain of custody.
There's no chain of custody.
So I think with what we offer is the chain of custody is quite clear. Any issue you have with any medication is directly sourced and tracked. We can tell you where the pack was from the manufacturer to when it got to the patient. I think that's an important part of using technology in the back end to also ensure that our supply chain is bulletproof.
Wow. So if I want to start a healthcare facility, well, I just go to Drugstock shop or what? How do I get the medication?
So very easy. Play Store, iStore, download the
An app.
Yeah.
Oh, so you're a tech company as well?
Yes.
All right.
So it's about access points, right?
Okay.
We use technology to ensure that no matter how you'd like to access the medication, we optimize and streamline for you. Some people with small facilities, they like to use the app. Some bigger facilities have a combination of the app and a web application. Some integrate directly into our inventory management systems. And if you don't like to use technology, you can also call our call centers, deal with a human, as we say as well. So we're a tech-focused company that's using technology to ensure that we leapfrog the system, but at the same time, we don't use technology as barriers in terms of our scale or access. The key word here is access. Every healthcare provider, no matter your technology reach, you need to be able to access drugs.
Within 24 hours.
Within 24 hours?
Yes. That's our brand promise.
Oh, wow. And you fulfill it?
We do. We work endless nights to fulfill it.
Yeah.
So how did you guys meet?
Oh, wow. What an interesting story. So we met in Holland, actually. I was doing my master's in health systems innovation, and I was trying to find somebody to take on my thesis. My professors insisted on finding somebody from Nigeria since they didn't know anything about the Nigerian healthcare system. So I ended up meeting Chibuzor, expecting some old person that has been a professor in Europe for 30 years. And I think we got along from day one. We bonded over a lot of the issues in the healthcare industry, and I think we've been friends since then. So that's actually how we met.
Yeah, I remember he walked into my office. I was wearing my shorts, had my earphones in my ear, I was jamming, preparing like my course schedule, and he walked in. And he was talking about Nigeria, and I'm like, okay. And then he spoke pidgin English.
Really?
Yeah.
What did he say?
It was like, bro, how far? I was like, what?
And you know, Holland is the type of place that you don't get to meet a lot of Nigerians or people from the same culture. So even having somebody to connect with and having even somebody to just speak freely with was a blessing. But I think what connected us the most is that we had a deep passion for healthcare and healthcare in Nigeria, and had a focus on changing things as well. So a couple of years later and a couple of sticky notes later, we had to find all the problems that we thought existed in Nigeria in the healthcare space, and we decided to tackle it from there.
Since then, sleepless nights building a company.
Oh my goodness. So was it at that time that you decided to start Drugstock, or was it after a while? How long were you friends?
So the story of Drugstock is one of, so what we had initially decided was we wanted to introduce managed healthcare sciences to Nigeria. And at the time we started a consulting firm that was working on managing a few clinics and primary healthcare centers. We were managing about 20 at the time, and we kept running into this challenge of pharmaceuticals. And eventually we decided one day to just put it on an Excel sheet, reach out to all these manufacturers, streamline all of that. And we tried. It kind of made sense. There was some value in it. And we decided to, at the time in this room, it was like a incubation center. There were IT people, economists, business, all of us just returnees, just doing things in a one bedroom of a hospital. And, eventually we decided to take this thing that we had worked for our facilities and, put it as a tech product and launch. Failed miserably.
Oh, really? I'd like to hear about that. What was the product and why did it fail?
So this was 2014. It was essentially a platform where pharmacies and hospitals could log in, and we had put at the back end, a number of suppliers who at the time we thought, we thought these were distributors and wholesalers at the time, and we had thought, they would solve our problem, and all of that. Turned out they had the same problems we were trying to solve.
What is the essential problem you're trying to solve?
It's actually a bit of it's a personal story, because it was the story of how I decided to move from practice, right? So there was, like, in 2008, I had literally practiced for about 2 years, and a family member I suffered the loss of a family member due to the lack of some medication at the point of emergency, and for me it was a sudden realization that for us in Nigeria, yes, we have a dearth of human resources in healthcare, but then even the ones we have are not deploying them enough, right? Because they don't have the resources they need and all of that. And for me, I just realized that, this whole thing of, I was in the healthcare system, the entire family might come from a family of all medical doctors, so does he. We have this all background of medical people, and it was just that, I'm in the system, and I couldn't even get the emergency medication that I needed for, this family member. And the family member was also a highly respected professor in the healthcare system, that teaching hospital. So it was just a shock for me, and the opening of my eyes to the fact that, it's not just about, it's not just about incompetence all the time or something. There were deeper fundamental issues, and that sort of got me thinking about what are the issues. Met a few friends who were economists, and they convinced me that, that the solution to the world was being an economist. So I went off and I left my practice, and this was like 3 years later, post that loss. I was specializing in orthopedic surgery, and then I decided, at the time, that I would leave, because I was having the same issues. Went to go and study economics and finance, bounced around the world working for the World Banks, the IFCs, WHOs, trying to work in that space of financing healthcare and supply chains and stuff like that. Eventually met Adham, and then we decided, instead of writing policy about all this, I might as well come back to Nigeria and do this. Moved back and started managing these hospitals, and same issue we ran into with pharmaceuticals. So at the time, people were going to Idumota to go bring drugs and all of that, people selling these drugs on the table. And for us, we were like, no, this doesn't make sense. And so we had to, I think we streamlined the process, put everything on this platform, and said, guys, you don't have to go there. You can buy from us online. Failed miserably. We pivoted, came up with a model that worked. And since then, the growth has been, and acceptance has been phenomenal.
Wow, that's very inspiring, because a lot of us talk about Nigeria and what the problems are, and very few of us get our hands dirty, boots on the ground to solve the problem. So it's interesting to see you, both of you, tackle a fundamental problem, which, from what you're saying, it's people being able to source genuine drugs. Not people, but the healthcare industry. Is that correct?
I mean, it's unacceptable, right? When you have an average doctor or a pharmacy not being able to ascertain the quality of the medication he's sourcing, or having a stable price for that medication to form some sort of predictability in the way he plans. I think all these things are unacceptable, considering the fact that the healthcare provider himself is already overwhelmed. You have, 20-something thousand doctors, around 20-something thousand pharmacists in the country. We're a population of 200 plus million and growing. So you don't expect the burden of the delivery of care to be placed on just the fact that you have a degree, because it takes a whole health system behind you to support your ability to disseminate your information properly and treat the patient properly. So as Chibuzo was saying, so imagine Chi as a healthcare family. Doctors, nurses are all part of his family, and even it was difficult for him to source a medication. imagine my family, my dad was a doctor his entire life in Nigeria. And in terms of the impact he would have put forward, even 30 years into his practice, when you ask him, can you ascertain the quality of the medication? Or if somebody has a cancer diagnosis, can you source the medication? It's completely aloof to how the pharma system works. And these are the gatekeepers of our healthcare industry. So we found that unacceptable. And we found that, I mean, it's even in our vision statement, or our mission statement rather, of empowering healthcare providers. The reason why we want to empower healthcare providers is because there's such a limited source. They're our gold at the moment in terms of our health system. And we have to protect that gold as much as possible and ensure that gold is empowered to give the service that they need to give.
Okay. So how did you guys get the money to start Drugstock?
Blood, sweat, and tears.
I mean, I think we took every single dime we made went into Drugstock.
Yeah.
Wow.
When he was with the IFC or the World Bank doing some consultancy gigs, when I was working at the
Oh,
healthcare
yeah.
facilities, I think every single thing we made went into actualizing this vision. And I think we were very clear about the vision from the get-go,
Yeah.
and about what we're trying to achieve with it. So we're also very fortunate to have like-minded people that I would consider very expensive assets in terms of human assets that were willing to sit down with us from the beginning as partners, as people that we can just talk to without necessarily having any financial exchanges. So I think building on that as well was quite important.
Yeah, I think if I recall the funding journey that we went through, it was quite interesting, because I think when we started fundraising, we were sort of not in the curve. Like, Nigeria was not yet in that curve of venture capital. Kenya had taken on.
Not an attractive
It
destination.
was not an attractive destination. So
Especially in healthcare where there's no money.
yeah. So people were not pricing us right. I mean, right. But it was a very interesting thing, and we just had this solid belief that this would work. I think in the beginning, threw all our money into it.
Wow.
Luckily, we were not married at the time. All with kids.
You were both single then.
We were both single.
Okay.
So threw all our money into it. After that, we got some angel investors that joined us. Okay. And then we got a VC out of the US. They came and backed us. That was the early stages of when Nigeria was now starting to look like, okay, what are these guys doing? And then after that, I guess we grew, and then it became a bit easier.
I know the VC. Great! Wow. So how long was this period of blood, sweat? I mean, I know it's still blood, sweat, and tears.
I
but
mean, she and I have been working together since maybe 2010.
Wow.
But in terms of starting Drugstock, the concept itself started in 2015 as a beta program.
Okay.
We self-funded all of that into late 2017, which is where we got some additional funding as well.
Okay.
So kind of follows a, I guess, textbook trajectory of you fund yourself, you get your family and friends to fund, and then you get the initial seed fund from a VC, and then of course now we're more institutional in terms of the way we approach investment and growth.
Wow. But when you started the business, what surprised you the most?
I think what surprised me the most is back then the general attitude about Nigeria cannot change, or this system is what it is. So I think there was a lot of discouragement from, these two boys are just crazy. They're just those two guys that just came back. They don't know what they're doing. They're just gonna try to do this, and we're just gonna be happy to smile in 3 years and watch them fail. So I think I think that general not kind of accepting what we're doing as part of what should be done, and rather having these barriers to why things cannot progress. I think that was the most frustrating thing. I think we're both very stubborn people, and both understand how this can impact the healthcare industry because we were providers. So it was unacceptable to us regardless of the constraints.
I think that's one of the things that's really critical in terms of the attitude, because what you're saying is that people are jaded and they have a sense of despair. They just apathy
Yes.
from apathy born from despair.
Yeah.
feeling like, well, there's no point trying because I'm not going to be able to succeed. Because how large is Drugstock now?
So we currently have somewhere around 80 plus.
80 employees.
80 employees.
80.
And that's because you have technology
Yeah.
to,
Oh, yeah.
to be more efficient.
Yeah.
Otherwise, you would have had
Definitely had more.
Yes, more. Interesting. So I was just wondering, you talked about what surprised you the most. What about you, Chibuzo? What surprised you the most?
I mean, I get surprised every time, but if I look back, right, I think for me personally, I mean, I'll take it on two levels, personally and on the business. I think personally, the amount of pain and sacrifice you had to go through to get the business going and where to keep it and how much you had to do to get the business to grow. I think I was fascinated by that people would actually go through that sort of and when I see people who have built a lot, I'm just looking at them, I'm like, wow, this guy's still going through this. Because even when you see huge businesses, you can tell that the person who is in the center is not, he's having the least favorite, and everybody else is looking at you like, oh my God, you're probably having a ball without realizing that you're the one dealing with all the issues. You only receive the bad information. The good stuff, everybody else takes credit.
Yes, true.
and rightly so, right? Because you bring in people who are more talented than you. But the difficult stuff are the decisions that we get at our table, right? And I guess that going through that process and being surprised, I think what we tell ourselves every year is, this is a positive though, because the flip side of that personal pain you go through, you also get to see some amazing things that happen. And I think every year we tell ourselves like, I can't wait to see what's going to happen next year because, we start somewhere and then, at the end of the year, we're like, whoa, we managed to pull this off? Like, no way,
So what challenges, top 3, would you say you face doing business in Nigeria?
So I think we face challenges that most small, medium scale enterprises, startups all face. I think the first thing I would say is there's a talent war going on now in the tech space. So human resources, we're competing with all them Apple and Google. And you know who wins? You're competing with those guys. So that's been a challenge. And then in the clinical space, everybody wants to go to Canada or the UK.
So brain drain.
Brain drain. So HR is challenging. Attracting and retaining talent. We've started to use distributed talent, so we're no longer just using people who work in Nigeria. We're using people who also in other parts of the world. Obviously, cash flow is always an issue. Now, there are people who say, yeah, you raise money, you manage, but the thing with cash flow in a fast-growing business is you're constantly at that verge of balancing growth versus how much cash you want to put in. And because the demand is so huge, you're always trying to manage that process and all of that. And then, debt financing is not cheap in Nigeria. So that's always, any finance is not cheap in Nigeria. So getting access to finance that you would want sometimes might not be mixed. You might not be able to match and mix the right combination for what you would necessarily need. We also, do you have any challenges?
Yeah, I mean, there's always challenges growing a business. I think the one that was evident to me is that when you go from a team of 6 to 7 people or a smaller team, everybody knows how you think or what the vision is, and then as you grow, you have a bit of this culture fade that has to be actively maintained because your teams are getting bigger, and the essence of what you do or how you interact might be lost. So I think part of the challenges with growing a business in Nigeria is ensuring that the more you employ and the bigger your team is, do they all still fall down to the core philosophies, the core attitudes of how we approach work, or even the core, why are we doing this in the first place? So at Drugstock, we're very oriented about, or we're very focused on ensuring that your career path aligns with Drugstock's ambitions and our ambitions align with your growth as well. So I think how to ensure that we get the right culture has been a bit of a challenge, but we actively pursue that. And actively ensure-
How do you do that? And how do you ensure that the person's kind of
Several-
personal vision aligns with Drugstock? Because that's kind of what you said in the
Several
first one.
techniques. I think the first thing at the beginning of any startup, you tend to feel like guarding your uniqueness or what you would want to put out in 2 years or 3 years. And I think the bigger your team get, the more you have to lose that fear that the idea is solely yours or the idea can be taken and disseminated. I mean, it's really all about execution.
Yeah.
So having just ensuring that they're in line with the vision, see where they fit into that vision, and being very forward about the plans for the next 10 years, not necessarily just the plan for the next year, I think kind of aligns the culture, right?
Also starts from hiring too, because when you're hiring, you want to ensure that we tend to try to find out, like, what do you do in your spare time, what do you do, those things, and it's tough in Nigeria hiring from the other side, right? I know I've interviewed for jobs before, so I know, like, a lot of employees feel like all the power, the influence is on the employer side, but oftentimes on the employer side, you're trying to find out something, you can't find it out, right? Because there's this hierarchical imbalance in Nigeria, whereas, like, people feel like they have to say the right thing for the employer to.
Yeah, I was wondering, do they really tell you what they do in their spare
Try as
time?
much as
Really?
possible.
They read books. That's what the person will say.
You try.
It's like
So
cookie cutter answers.
yeah. So people say things like, obviously people say things like, I read books. Yeah, okay, so if you weren't reading a book, what would you be doing? if you weren't doing this life in tech, what would you be doing? What do you do on Saturdays? What do you? And from there you get an inkling to find, and then people. Oftentimes when you engage people in a conversation for 30, 45 minutes, they will tell you something that you can learn about them. And a lot of the times when I'm refusing a candidate, it's usually very clear in the interview to the candidate why. Because by the time candidates get to us, it's not about, are you skilled or not skilled? It's often about, do you really want to work with us? Like like most candidates are the ones who even tell themselves, yeah, I don't think I can work.
I don't think I can hack it
Yeah.
here. So how do two stubborn guys, by your own admission, work together?
I mean, we were friends way before working together, and I think we both share very similar passions in life. We like to talk about the same things, think about the same things. In terms of work, it's not all roses. I mean, sometimes there are tough decisions to be made. But I think one thing we've always been able to rely on is the fact that there's an underlying acceptance of what the vision for Drugstock has always been and will always be. And as long as it's going towards that vision, if he's being an impediment, he steps aside. If I'm being an impediment, I step aside. And I think part of when you grow, you learn to organize yourself a bit better in terms of what the roles actually are.
Yeah.
Before, when we first started, it was like, she and Adham doing everything. We deliver, we count, we do procurement, we sit down with management meetings. But now, as we grow, I realize that, listen, I don't need to be in some of your meetings. You don't need to be in some of mine. But we need to create a structure that's clear. And I think that's been the best way for us to find.
So who does what?
So essentially, operations, finance, strategy.
Who is a stricter person?
It depends on what topic. I'd say in the office, perhaps I'm a bit stricter in terms of like operational. Because I have to be. I'm an operation.
Yes.
But
So he's good cop, you're the bad cop, or what?
not necessarily.
I don't think it's a fixed role. I don't
Okay,
think
so
it's a
you
fixed,
switch up depending on what's needed.
Don't tell everybody.
Well, they're going to know now.
But it's been great. I think anybody that's going to start a business with a friend, I think needs to understand that the relationship and the vision of the company has to be clear. And you have to understand where the friendship stops and where business starts. And I think that's been a learning curve. We're still learning. It's not that we have it perfectly, but I can say that we're still very, very good friends. I mean, one of my best friends here. So from that point of view, I'd say it has been a good experience.
So have you had a time when you had like core difference in opinions on how business should go? Or
all the time.
how did you guys handle that?
So I think it comes down to the roles, right? Everybody has their roles and everybody has what they lead, right? And my philosophy, and we share that philosophy to a certain extent, is that 80% is good to move it forward. 20% where you're going to spend 80% of your energy arguing, I kick it down the line. When it gets to that point, getting experts.
Yeah.
Okay.
So I'm more of a perfectionist. Everything has to work. So I
That's me.
use him to balance me a lot.
Okay.
You know, so, but I think the answer to your question in general is very good communication.
Yeah.
Like we've had this for a long time, whereby Chi and I cannot. It's very hard for you to put a topic between us that we cannot see eye to eye based on just logical deductions of what is right and what is wrong. Maybe I'm not understanding something, or I don't see a perspective. I'm open-minded towards hearing his perspective, and because I trust him, I know he's not coming from any angle that is not for the vision of the company. We have to take each other seriously, despite.
Yeah, so it's basically communication and respect, because you just need to be able to talk about whatever. Because fighting is not usually a problem. It's how you handle the communication and how you handle all the other things that happen around the fight that usually is the problem. But when you have a difference of opinion, you have a difference of opinion. You talk about it and you get it done. Because at the end of the day, right, the company needs to move forward. And once that is very apparent and clear to everybody, then every other decision is secondary.
What impact, looking back, do you see that Drugstock has had? And what makes you keep going?
It's been an interesting journey. And in terms of impact and my journey in Nigeria, I mean, I love Nigeria. It's where I live. It's where my family is. I feel like it has the most potential in Africa. Biggest black population on the planet. I feel like that should stand for something. I feel like we should change the narrative or the scope of how we present Nigeria, and I think that's all in our own hands. The second point I'll make is that what inspires me about Nigeria is that I feel like the youth of Nigeria are miles ahead of the leaders of Nigeria, or at least the de facto leaders that have been there for the past few years. Hopefully we get some innovative ones going forward. And I feel like that expression of the youth's ability and that picture that Nigeria has, or that depiction Nigeria has on the foreign scene, I think if people got to know the youth and the people that work around me and all the great people I meet in this country, I think they would be more than inspired to invest in Nigeria, and more than inspired that Nigeria is actually the giant of Africa, or can potentially be a giant of the world.
So I think for me, when I look back, one of the things that I am very proud about is the level of quality that has so far come to the industry. So when we started this, right, like he was saying, people were laughing at us. These two guys are crazy. Now, it's the norm in industry to try and deliver. It's the norm in industry to package things properly. It's the norm to try to attach documentation to what you're doing. It's the norm in industry to get from manufacturers. So people are beginning to, and so I'm quite happy about that general improvement in quality in the industry, where people no longer just are like, it's Nigeria, it doesn't matter, just go and get the drugs wherever. So that I'm quite happy about. In terms of why do I do it? So it's the same reason why I stepped out of practice, Frankly speaking, if you ask me what I want to, honestly, I'd just rather be a bartender.
A bartender?
Bartender. Like, not too much stress, no thinking, great conversations with whoever's in front of you.
Yes.
But for me, when I stepped out of practice, what was primarily at the top of my mind was just the fact that there were just some glaring issues. And they were too, it's better you don't know something. I'm not the kind of person that I know about something and I'll just be like, I'm fine.
You must do something
about it.
about
Like I must do
it.
something about it.
See.
So for me, it's very difficult to just be asleep and just have back of my mind that this is where people are getting drugs from. And if I go into a pharmacy, or my mom or my uncle or my sister, my brother, my friend, my neighbor goes to a hospital, they're not sure about what they're getting. And as long as I have that thought,
you have to do something about it. That's interesting.
Right.
Wow, couldn't say it better. Last question for both of you. What would you say to 25-year-old Adham, 25-year-old Chibuzo, that wants to start business in Nigeria? One thing, what would you say to yourself, going back, rewinding?
you can do it.
You can do it. I like that.
one thing, only
One thing.
I would say be clear about your vision and just work out how to operationalize it. Don't paint in dreams, paint your reality. So have your dream set up what your daily activities are and work towards that.
Thank you so much. It's been such a pleasure having these wonderful gentlemen with us. Adham,
Thank you.
Chibuzo,
Thank you,
it's been
Amaka.
wonderful having you. Thanks for
great
coming on
being
Seed
here.
Diaries.
Thank you very much.
Thank you.
We believe in community.